Good afternoon, everyone. Okay. So good afternoon, everyone. We are welcome to today's webinar organized by the Duchess International Hospital to celebrate the World Immunization Week. My name is Dr. Akunne Somtochukwu. The World Immunization Week is celebrated yearly, and the theme for this year is Humanly Possible, Saving Lives Through Immunization. Over the years, there has been significant reduction in the number of deaths and complications that arise from vaccine preventable diseases owing to immunization. However, there is still a lot of work to be done because the uptake of these vaccines in this part of the world especially is still very suboptimal, and this is for various reasons. So this session has been organized to shed more light on immunization, as well as reiterate the benefits of immunization to the child, the family, and the nation at large. So the head of the pediatric nursing team, Nurse Eniafe Ekumakpai, will be giving us key information on immunization. Thank you.
Good afternoon, everyone. My name is Eniafe Ekumakpai, and I'm so happy to be here this morning. And thank you so much for joining him. Okay. 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 So this afternoon I'll be giving an essential insights on immunization. So my point of discussion this afternoon, it covers the introduction, immunization coverage in Nigeria. I'll be discussing also on the current immunization schedule in Nigeria, benefits of immunization, common side effects, the myths and misconception about immunization, commonly asked questions. So here, what is immunization? Immunization is a process by which an individual's immune system becomes fortified against an agent. So when you hear the word immunization, it's just a process by which an immune system or the body system is being fortified against an agent through the process called vaccination. So you actually fortify your body system against infectious disease, against diseases through vaccination. So what is vaccination? A vaccination is any preparation or any preventive preparation that helps build the body immune system against diseases. Or the vaccine is administered to stimulate the body immune system in order to produce a specific response that helps fight pathogens. So we have different types of vaccines. We have live attenuated vaccines, we have inactivated vaccines, we have subunits, recombinant, polysaccharide, and conjugate vaccines. We have toisoid vaccines as well. Here I'll be throwing more light on live attenuated vaccine. When we talk about live attenuated vaccine, what do we mean? Is live attenuated vaccine is made of a living organism. When a living organism is being weakened and is made not to, harm the body system. And we have different types of vaccines under this live attenuated vaccine. We have BCG, we have that's the bacillus, the cametigurine, oral polio vaccine, we have measles, we have mumps, rubella, and chickenpox. Also, we have inactivated vaccine as well. Here, the vaccine is not viable. And under this inactivated, we have influenza vaccine, inactivated polio vaccine, we have rabies, we have hepatitis B. Another subunit, recombinant, polysaccharide, and conjugate vaccine, we have OPV, HPV, OPV is oral polio, PCV rather, PCV is pneumococcal conjugate vaccine, and we have HPV, that's a hepatitis B vaccine, and we have HIV, which is influenza vaccine. That's Haemophilus influenza vaccine. Then we have toisoid. Other toisoid, we have diphtheria and tetanus toisoid. So here we'll be talking about immunization coverage in Nigeria. Immunization coverage in Nigeria is one of the indicators that is being used to monitor progress towards reduction in child morbidity and mortality. And what do we here to achieve with this immunization coverage in Nigeria is just to ensure that there is an improvement and increase in awareness and reiterating the benefits of immunization in children. Here, the target of World Health Organization is that there should be 90% of national coverage with 3 doses of DPT. So a child is expected to have 3 doses of DPT, 3 doses of oral polio vaccines, and 1 doses of measles. Looking at this graphic line, we can see here, I'll be making reference to 2008 National Demographic Health Survey is being done. We can see here that the number of children that has basic immunization are just 28%. And at the last survey that was done at 2018, we see that there's a significant improvement, even though we are not there. And the aims of what Health Organization is for us to get to 70%, and comparing 70% with 31%, which means that we still have a long way to go. So here at 2008, the National Demographic Health Survey has only have 23 children that has basic vaccination, while at 2018, we have 31 children that has basic, and we can even see the red line, so we can see that at 2018, we only have 19% of non-vaccinated children. Here, I'll be throwing more light on immunization schedule. What are the vaccines that your child are entitled to? A new one is to have OPV, that's oral polio vaccine, BCG, that's bacillus, cametigurine, hepatitis B at birth. And what do we aim to achieve by giving this vaccine? The BCG prevents, it protects against tuberculosis, while oral polio vaccines protect against poliomyelitis, and for hepatitis B, protect against hepatitis B disease. Now, these 3 vaccines are given immediately after birth. This must be given, most especially the hepatitis B, must be given within 24 hours after birth, while the OPV and the BCG should also be given immediately, but in case if it is not available, the child should have it within a month. These vaccines for BCG is given intradermal, that is just under the skin, usually use the upper arm. For OPV is mouth by mouth, and for the hepatitis B is given at the anterolateral aspect of the thigh. Now, after the advanced vaccines, then we'll move to 6 weeks vaccination. Here at 6 weeks, 10th weeks, and 14th weeks vaccination are almost the same vaccines. At birth, the child has 0 dose of OPV, and hepatitis B is also 0 dose. But at 6 weeks, we start counting the dose. So the child is expected to have 3 doses of this vaccines I'm about to mention. They're expected to have 3 doses of pentavalent, PCV, that's pneumococcal conjugate vaccine, and they're also expected to have 3 doses of OPV, that's oral polio vaccines. So pentavalent vaccine is like a 5-in-1 vaccine. It's a 5-in-1 vaccine. And what are these vaccines? We have diphtheria vaccines, which protect against diphtheria. We have pertussis that protect against whooping cough. We have tetanus that protects children against tetanus. And we also have Haemophilus influenza type B. We have different types of Haemophilus influenza. We have type A, we have type B, we have type C, we have type D. But this particular Haemophilus influenza protect against Haemophilus influenza type B. Also, it protects against the 5th one of this pentavalent vaccine is the hepatitis B. I will say it again, hepatitis B is 5-in-1 vaccine, which are diphtheria, pertussis, whooping cough, hepatitis B, and Haemophilus influenza type B. And this is also given, most of these vaccines are given at the anterolateral aspect of the right thigh. That's for PCV, for pneumococcal conjugate vaccines. For oral polio, it is given by mouth. Now we move to pneumococcal conjugate vaccine. Pneumococcal conjugate vaccine protect against pneumococci, and it's given at 6 weeks, 10th weeks, and 14th weeks. Then we have IPV. IPV is inactivated polio vaccines, and this also prevents poliomyelitis in children. Now I move to 10th weeks vaccine. 10th weeks vaccine, like I said before, that is just like the same set of vaccine. Sorry, at 6 weeks, we also give rotavirus vaccine. At 10th weeks, we give rotavirus vaccines. What rotavirus vaccine does is to protect the child against diarrhea and vomiting. Now we move to 10th weeks vaccine, still the same set of vaccine, the pentavalent, the pneumococcal conjugate vaccine, the oral polio vaccine, and the rotavirus vaccines. But at 10th weeks, it means the child is taking the 2nd dose. Now at 14th weeks, the child is still taking the same set of vaccines, just like we have it in 6 weeks, we have it in 10th weeks and 14th weeks. 14th weeks, the child is still taking pentavalent, pneumococcal conjugate vaccine, oral polio vaccine, and rotavirus vaccines. Like I said before, the penta and pneumococcal conjugate vaccine are given at the anterolateral aspect of the thigh, while OPV is given by mouth. Now, at 6 months, the child is expected, okay, let me show more light on rotavirus vaccine. For rotavirus vaccine, we have Rotatec and Rotaris. If your child is taking Rotaris, then your child only needs to take 2 doses. But if it is Rotatec, then it means the child must have 3 doses. So now we move to 6-month vaccine. So what are the vaccines that your child is expected to take at 6 months? Child is to commence vitamin A first dose. Vitamin A first dose. Basically, vitamin A is not really a vaccine per se. It is a supplement. It's a supplement. Now, although aside from this NPI immunization schedule, we have other vaccines as well that are not available, that are not included in this NPA NPA schedules, but we have them at our hospital, at the Duchess International Hospital. So like I said, for that 6 months, your child is to take vitamin A first dose, and at 9 months is to have the first dose of measles vaccine, yellow fever, the measles protect against measles infection. Also is to take yellow fever. This also protect against yellow fever disease. And also at the same 9 months is to take meningococcal vaccine. And this meningococcal vaccine protect against meningitis. Now we move to 12 months. At 12 months, like I said before, that with the child starts taking vitamin A, that starts taking vitamin A from 6 months, and is to have this vitamin A every 6 months till when the child is 5 years. So your child is entitled to take vitamin A from every 6 months till when the child is 5 years old. Then at 12 months, what are the vaccines that your child is expected to take? Is expected to take vitamin A second dose. Then we move to 15 months. 15 months is to take the second dose of measles. Then again at till 9 years before, then maybe you cannot take human papilloma virus. This is also very essential. This is included in our NPI immunization schedule. Though we have other non-NPI vaccines that are available at the Duchess International Hospital, which are also beneficial to your child, like hepatitis A, we have cholera, we have MMR, it's called measles, mumps, and rubella. We have varicella vaccine that prevents, what does hepatitis A means? It prevents hepatitis A infection. It's for cholera, it prevents diarrhea and vomiting in children. And for MMR, is measles, mumps, and rubella. So it's prevent against measles, mumps, and rubella. And for varicella, also it prevents, it protects against chickenpox. So these vaccines are not included in the NPI schedule, but we have them at the Duchess International Hospital, even though these go at a cost. So like I said before, that the BCG should be given at birth and can be given up to 11 months. The OPV vaccine, these are the best vaccines. The OPV, the oral polio vaccine must be given before the age of 2 weeks, and hepatitis B should be given at birth or within the 24 hours of birth. So during the course of explaining the different vaccines for different when I was explaining the different vaccines that we have, I made mention of the routes of administration of some of them, and you can see a picture of a child taking measles by mouth. You can also see a picture of where an intradermal injection is being given. Just this is how a BCG vaccine is being given, and we can see an anterolateral aspect of the thigh. That's all the injection given intramuscularly, and the other one, the other picture displayed on the screen, we can see this a picture displaying where a subcutaneous injection is being given at the 40-degree angle. What are the benefits of immunization? The benefits of immunization can never be overemphasized. We have various benefits of vaccines. One of them is it protects against infectious disease. Just like we were mentioning before, it protects against poliomyelitis, it protects against tuberculosis, measles, and just name them. And also reduces the spread of diseases in school, in the community, even at family. It helps reduces the spread of diseases. Other benefits are it reduces the risk of disease outbreaks and epidemics. It helps to protect children. It helps to keep the elder children, and they're able to grow and develop normally. Healthy children become healthy adults and produce a healthy nation. And also, one of the benefits of immunization is that it reduces hospital visits and school absenteeism. Children benefit maximally from their education. They don't have to be absent in their school. When they get the right immunization and have a complete immunization, your children will be able to concentrate in their school. You don't need to have to start taking them to the hospital to treat one infection or the other. Also, it reduces the need for antibiotics therapy and the development of antibiotic resistance. You don't have to spend more on antibiotics therapy, antibiotics injection, and even, there are others resistance that comes with even giving these antibiotics as well. Also, it helps to prevent a long-time complications like paralysis, like encephalitis, infertility. Also, is develop a health immunity. That is a population immunity, a community immunity, because if the majority of the population are immunized against this contagious disease, the rate at which this infection or disease are being spread is contained. Also, it gives protection for vulnerable populations like the older adults, those on steroid. And also, it reduces the economic burden that is associated with hospitalization, the management of disease outbreak, and loss of productivity. Another benefit of this immunization is that immunization contributes to sustainable development by enhancing productivity. Just like lost man hours from parents having to look after their children suffering from these diseases. So if your child is immunized, you will not have to, be worried or have to think of bringing your child to the hospital, to treat all these. They're actually a preventable disease, and that's why immunization is very, very important, that you immunize them at the right time and have all this covered so that we can reduce the number of hospitalization. We have other benefits of vaccines, of immunization. At that point, when you come to the hospital to take your child immunization, you get to have one-on-one interaction with your expert practitioner, the pediatrician, the pediatric nurses. If you have any question that's been bothering your mind at that moment, is an opportunity for you to be able to clear your mind. And also during this period, the anthropometric measurements are being taken, like the height, the weight, and are being documented. So in case if we notice the child is not gaining weight, the child is not, achieving the expected milestone, this will be detected early. And also during the course of this vaccination, you get some dietary counseling, and we have some facilities that also, do, like when you are about to wean your child from breast milk, you tend to get some food, food demonstration. They give you a classes where you'll be able to have different varieties of food for your child. Also, what are the common side effects of vaccines? We have fever, we have redness, we have swelling, we have pain at the injection site. Sometimes a small hard lump, like a nodule at the injection site, may persist for weeks or even months. This should not be of concern, and it requires no treatment. Actually, these are just mild side effects that you can get from vaccines. Their fever, redness, swelling, and pain at injection is not something to really be worried about. The reactions are expected and within 24 hours, even after vaccines, all these side effects or the symptoms disappears. And we have a really allergic reaction. What are the myths and misconceptions about immunization? We have some myths and misconceptions about immunization. Some believe that vaccines cause autism, and sudden infant death syndrome, which we call SIDS. Some also believe that vaccines cause sterility. Some believe that vaccine preventable disease, that's the VPD, that vaccine preventable diseases are just part of childhood, and it's better to have the disease than becoming immune through those vaccines. This is a misconception that you cannot, that it's better for you to have a disease. You know, it's better to have the disease than becoming immunized, than taking the vaccination. Maybe at the point where you now have it, your body will not develop a resistance against it. This is actually false, because if you want to, the benefit of immunization actually outweighs, you know, you don't want to take the risk of not vaccinating your child, of not vaccinating your child, leaving them thinking that their immune system will be able to fight against this infection. And now when the whole, you know, maybe the child now comes down with meningitis, and now you now want to like start vaccinating the child. At that time, things would have, you know, gone very bad. So some also believe that I don't need to vaccinate my child because all other children around them are already immunized. If just a few, like I've said when I was explaining the herd immunity, that if a few number of children are immunized, it means that the community, the population is not safe. Until we have the majority, like the World Health Organization said, that 90% of children should be immunized. Like we have some basic vaccination I've mentioned before. So it is very important that your child have all these vaccines at the right time. Also, some also believe that I don't need to vaccinate my child because other children around them are already immune. Vaccine cause harmful side effects, illnesses, or even death. So all these are misconceptions, and all of these are not true, and it does not cause any major side effects, doesn't cause paralysis, doesn't cause, you don't have to wait till when your child has the disease before you have to vaccinate your child. All these misconceptions are actually false. The vaccines are very, very effective and they are safe. Though they have some side effects, like I've mentioned before, like fever, redness, pain, swelling at the injection time, they are just mild and they are temporal, like I said before. So they are not something that can cause harm to your child. So what are the commonly asked questions? We have some commonly asked questions like, can the child still have the disease after immunization? So immunization prevents the child from being infected, as well as prevents severe infection in immunized children. To prevent infection or disease spread, other measures should be ensured. This includes hand washing, environmental sanitation, and avoid overcrowding. Even after you have taken your vaccines, you still not like, lose guard and just feel like, oh, I don't need to practice my hand hygiene. I don't need to keep my environment clean. All of this should still be in place even after taking your vaccination. Also, if my child makes getting a vaccine, do they need to start this series over again? No. If your child makes a dose of vaccine, they do not need to start the whole series again. Your child can pick up from where they left off, regardless of the time between the doses. Let's say, for example, your child has taken 6 weeks vaccine, and you are now coming in when the child is 6 months. We can always start from where you stop. So the summary of this whole discussion is that immunization is a cost-effective health prevention strategy. Vaccines are generally safe, they are effective, and they are safe. Immunizing a child benefits the child, not just the child alone, it benefits the family and the whole society. It can also lead to herd community, that's building a community immunity and a population immunity. And like I said before, that the side effects are usually very mild and temporal. Thank you.
Okay, thank you very much, Nurse Enyafe Umakwae, for the very insightful discussion. Just to buttress some of the points that she has mentioned, that vaccines are safe. We cannot say that enough because most people, or there is some level of vaccine hesitancy because of the fear of side effects or some misconceptions that people have about it. Vaccines are safe, they are not harmful, they do not cause diseases, and the side effects, as she has mentioned on several occasions, that they are mild and they are very temporary. Most times, the common one is fever. And once the child is able to get the appropriate dose of paracetamol, the fever should subside over 2 to 3 days. And if there's swelling at the site of the injection, ice packs or a cloth wrapped ice block wrapped with cloth can be placed intermittently over the injection site. This would relieve pain and swelling. So it's not something to be very worried about. So as she has also talked about, that beyond the health benefits of immunization, the child being spared from coming down with these common infections, that children are also well enough to go to school. The child doesn't have to keep missing schools just to visit the hospital for reviews and treatments. Parents also benefit indirectly or directly, as the case may be, because the financial burden on them in terms of caring for a sick child and also staying away from work will not be the case. And there is reduced financial burden on the economy. We can remember when we had the COVID pandemic, it was new to us then, and the government had to spend a lot of money to manage the situation. So if we get our children immunized and also the adults, this will not be the case. Okay, then she also talked about some parents not getting their children immunized because they believe having immunity from the disease itself is safer. But the truth is that complications that can arise from these infections, or even can be so severe and life-threatening, like the paralysis that arise from polio infection. We don't get to see that too commonly as it used to be because of the polio vaccines that are in place. And also, let me also talk about the recently introduced human papilloma virus vaccine, that's the HPV vaccine for the female children from age 9 and above. Yes, it's a new one, and it's also an opportunity to spread the word that it is very beneficial to get our female children immunized. It's also open to the male children, yes, but the emphasis is on the female children because of the burden of cervical cancer in females. So if you can get your male child immunized, who also falls in the recommended age bracket, it's also important. And Sister Nyafe went to town on the immunization schedule in Nigeria currently. On the immunization schedule in Nigeria currently, yes, these vaccines are available, and we also have the non-MPI vaccines that are also available, but are yet to be incorporated into the national immunization plan. These vaccines are available, and if we should also try as much as possible to get them. Yes, they are all beneficial because I've heard parents talk about that if it is that important, why is it not part of the vaccines on the immunization schedule? Government gradually introduces these vaccines because what we have currently is not what we used to have years ago. So we can see that some of the ones that were not available then are now available, and there are some that are yet to be incorporated, and I believe that with time, all of this will be available to all our children, available for all our children. And these vaccines are actually available at the Duchess International Hospital. Yes, the ones on the schedule and the non-MPI vaccines, all are available at the Duchess International Hospital. So apart from the immunization services that we render, at the Duchess Hospital. We also provide pediatric intensive care services. We have the neonatal intensive care services available as well. The surgical services for children are available, and other specialist services, optical, dental, audiology, are all available at the Duchess Hospital. The Duchess International Hospital is a 100-bed multi-specialist facility, and here we provide primary, secondary, and tertiary care to patients. And we also provide access to affordable world-class health service in Nigeria. Our mission is to reverse medical tourism by delivering the highest standards of care using the most advanced technology and treatments to give our clients the fastest, most convenient access to the best medical expertise available anywhere in the world. So thank you very much for being a great audience. Now it's time for Q&A. We can type in our questions in the chat box. And for those that would want to ask, you can unmute yourself and ask your questions. Thank you very much. The floor is open for questions. I can see a hand up. Oluwatobi Kalejai, you can unmute yourself, please.
Good afternoon, Dr. Sumter.
Kalejai, you can unmute yourself and ask your question.
Can you hear me?
Yes, please.
Good afternoon, Dr. Sumter. Good afternoon, Oseniafe. Thank you for your presentation. It was well explicit. Thank you so much. I want you to please, Oseniafe, this is for you. Please, I want you to please elaborate. I heard you mention that there are two types of rota vaccine. Please, can you please shed more light on it? Thank you.
Okay, so we have two types of rotavirus vaccine. These are they are different brands actually. We have Rotatec and the Rotaris. For Rotaris, if you are using this brand of Rotaris, you can only take 2 doses. And if you are using Rotatec, it means you are taking 3 doses. Still the same content, but the different brands. So if you are using Rotaris, your child is to take 2 doses. But if you are using Rotatec, which is another brand of a rotavirus vaccine, then your child is to have 3 doses, but still the same content. Thank you.
Okay, thank you, Kalejai. Any other question? Okay, so the notes in the chat box. Thank you, Noseniafe. Well done, Noseniafe. Thank you, Noseniafe. Okay. So any more questions, please? Clarifications, concerns?
Any more questions, please?
Okay. No other hand is raised, so it's safe to assume that we are okay with the presentation. So on that note, okay, I can see Goodness. You can unmute and ask your question.
Okay, good afternoon, everyone. Thank you for this wonderful presentation. Thank you so much. My question is on the other brand of the cholera vaccine, which is the Rotatec you mentioned. So you said it's 3 doses. So what is the time duration between those 3 doses?
Okay, thank you, Goodness Okeke, for the question. So for the Rotatec, the first dose is taken at 6 weeks, second dose taken at 10th weeks, and the third dose taken at 14th weeks. That's if you are using that brand of vaccine. Or if you are using Rotaris, it's to be taken 6 weeks and 10th weeks. Thank you.
Okay, so I'd also like to add to what she has talked about the rotavirus vaccine, that the series should be completed before the child turns 8 months, because after 8 months, there is no need for the child to get the rotavirus vaccine. The first dose should be gotten before the child turns 15 weeks, and for the 3-dose vaccine, you should have 4 weeks interval between the doses, and for the 2 dose vaccine, you should have 4 weeks as well, but each should be completed before the child turns 8 months. Thank you. Okay, Sister Alice Olubajo, you can go ahead with your question, please.
Thank you, ma'am. Good afternoon, everyone. Can you hear me?
You can be heard.
Oh, thank you. So I just need clarification on how do we advise parents that have their children receiving these NPI, polio, oral polio, vaccines in schools, assuming a child is already up to date on their vaccines with, let's say, with the health facility, and these national health primary health workers going around to administer all these other vaccines. Is there any risk? Do you see any risk with this type of exercise? And how do we advise the parents of such children? Is the question clear at all?
Thank you very much for your question. Yes, you asked if there is any risk associated with getting vaccines from sorry, please, with the ones that they have to go house to house to administer. Is that it?
Yeah, exactly. Thank you.
Okay. So there is no risk associated with that. All of these efforts are just to get as many children as possible immunized. They are called the supplemental immunizations that are given on some specified days, usually for children younger than 5 years. So there are no risks associated at all. Yes, so for every child that has the opportunity to get that, they should. But if the child has just received the polio vaccine from the health facility, that should be made known to the people that come around to give these vaccines. Because I know when they come to schools, they always give a note to the parents to approve if the children should receive or if the child should receive or not. So it can be stated in that card or the notes that the child recently got the vaccine. So that is why they wouldn't want their child to be get the vaccine at the school. So there is no risk associated at all. Thank you very much. Okay.
Thank you.
Olamide Elizabeth, please go ahead.
Thank you. Thank you for the wonderful presentation. Well, that's really a good one. Thank you so much. So I want to ask, at what age can you say a child will not be vaccinated again? Let's take, for instance, if a 10-year-old or 15-year-old, a 15-year-old boy comes in, says he has never been vaccinated, so can you still vaccinate? So at what age would you stop or say you cannot vaccinate a child? Hello?
So there is no age, if I can say that. Yes. So it's if you get the immunization history of this child, you can walk around that. So for a child that has never been immunized, the child may not get some of the primary immunization vaccines, like the BCG, you don't go straight on to give. You have to screen the child for TB before it is administered. The child can still get the polio vaccines and some other vaccines. Yes, so there's really no age. We have booster doses for most of these vaccines, which children that are older than 10 or older than 5 can still benefit from. So there's really no age to say this person cannot be immunized again. Yes, so the rotavirus has a cap to it because of the age incidence, the age where you have the peak incidence of diarrhea diseases. That is why. Beyond that, you should, the advocacy should be hand washing, environmental sanitation, and all of that. But the other vaccines can be administered. I don't know if that answers your question.
Yes, thank you.
Okay, thank you very much. Then there's a question in the chat box. Is it compulsory for a child to have the BCG mark? So it is not compulsory. However, the BCG scar is an objective way to say that this child has been immuned or has been immunized rather. But because of some peculiar reasons, the BCG vaccine is given intradermally, but if given intramuscularly, maybe due to technique error, the child may not develop the scar. But if there are concerns about the scar not appearing on a child that has received this vaccine, the child can actually be re-vaccinated, but the child has to be screened first, has to be tested first to know if he or she developed some form of immunity. If not, the child can be revaccinated. Christine Ononiwu, I don't know if that answers your question.
Yes, ma'am. Thank you so much.
All right. Any other question? Joanne Isibo, please go ahead.
Hello, good afternoon. I want to say thank you to the presenters for such a brilliant presentation. So my question is related to the HPV vaccine. Now, one of the presenters said it can be given to children, but what about adult women who want to protect themselves against cervical cancer, and we've passed that tender age where we feel we can't be eligible? But is there an age where adult women can be given the HPV vaccine to help protect against cervical cancer? And also, how many doses would they have to take?
Okay, thank you. So about the HPV vaccine, it is recommended before sexual activity commences. That is the recommendation. However, it is still given to older women or older females, but they have to be screened first for HPV before the vaccine is administered. So now everybody can get the vaccine, every female can get the vaccine. For the younger child, younger female from age 9, and for the older females, you have to be screened. And if you test negative, you go ahead and get vaccinated. It's usually 2 doses, 6 months apart. Yes, even though there are some recommendations of 3 doses, 1 at first encounter, 4 weeks after, and 6 months later. Just within 6 months, the 3 doses should be completed. But however, whichever one the person gets, it should be completed within 6 months. So younger females, older females can all benefit from the HPV vaccine. Thank you. Any other question? Okay, no other hand is raised and no other question in the chat box. So thank you very much for being a wonderful audience. Thank you to Nurse Eniafe for the very detailed presentation. We look forward to having more sessions in the future. Thank you and have a good afternoon.